Hi, welcome. This is Dr. Felice Gersh, and I am your host for the show tonight. I am actually labeling this particular show as the inaugural show, the PCOS program or the PCOS show. From this point forward, about twice a month, I plan to do a show completely devoted to the topic of women and polycystic ovary syndrome, PCOS. PCOS is the most common endocrine dysfunction of women, and it does not get anywhere near the attention that it deserves. And consequently, the women who suffer from this condition really do not get the attention that they deserve as well. In fact, there are studies now showing that a huge percentage of women with PCOS are not diagnosed even to have that condition until they visited multiple doctors, even over several years. And even after that, the condition is not treated really in the way that it should. They're given often the same treatment of birth control pills, metformin, and so on that they got maybe 30 years ago. And there's so much new information about polycystic ovary syndrome. And that is my job. My job is to share my knowledge with you and to open your world to the great possibilities that are out there to really transform the lives of women with polycystic ovary syndrome. I want to start, for those of you who don't know me, with just giving you a little background on myself. I am one of the few OBGYN doctors who are functionally and integratively trained. I did the 2-year fellowship in integrative medicine at the University of Arizona School of Medicine, and I've taken many, many courses in functional medicine. I have now devoted a significant part of my career. The bulk of my career is actually in my office where I am right now. I'm in actually one of my exam rooms. And the bulk of my career is in caring one-on-one for my patients. But part of my career is now devoted to traveling literally around the world and doing lectures and educating not just patients, but actually doctors on the condition polycystic ovarian syndrome and all of the many manifestations and myriad sort of, we'll say, collateral issues that are associated with polycystic ovarian syndrome. And I want you all to know that I am now currently writing a book on polycystic ovarian syndrome, which will probably be available within the next 6 months. So I'll keep you informed of my progress on it. Tonight, we're going to talk about a very important topic, one which, as many of the other topics involved in PCOS, is not getting anywhere near the attention that it does deserve. So let's think about a typical woman with polycystic ovary syndrome. She is, we'll say, 25 years old. She wakes up in the morning, goes into the bathroom, and looks in the mirror. She sees a young woman who is perhaps 40 pounds overweight, has many pieces of acne marks on her face, scarring. She has cystic acne, active acne. She also has facial hair. I mean, she has to shave in the morning. She has a beard. She may have a mustache, or it's like, oh, I better go get some laser hair removal treatment appointments and so on. So she has to deal with that. She looks at her hair and it's thinning. She looks and it looks like, it's kind of got male pattern baldness. And then, she gets changed and she's so upset because she has to wear such a large size outfit. And it's very depressing. So yes, that is one of the many reasons why women with PCOS have substantially higher rates of depression and also of anxiety compared to the same women who do not have PCOS of the same age group. In fact, we now have data that women with polycystic ovary syndrome have depression rates about 3.5 times that of the average population, and anxiety rates almost 4 times the average of a woman of the same age. So that's what we're going to talk about tonight: anxiety and depression in women with PCOS. So as I said, one of the reasons that women have more depression with PCOS is because they're so unhappy in their own bodies. They struggle to lose weight, no matter how little they eat. In fact, I had a patient just today. I want to share her story. She actually was new to me as a patient. She's a young woman in her mid-20s, similar to the one I described in my little story. She actually came to me, obviously, because she'd been struggling all over talking to other doctors, and she actually went on birth control pills. She went on spironolactone. It did not help her. And she actually gained something like 15 pounds after she went on oral contraceptives. It was certainly not any sort of help for her whatsoever. And she said someone she met, she hadn't even known this woman before. She was at some kind of a conference that she was working at. And this woman came over and said, you know, I've been watching you at this conference and you eat so little. How is it that you can eat so little and yet be so overweight? And my new patient, she just broke down in tears. And it's like, I know she probably was trying to be helpful, but it just hit me so hard that here I am. And she's right. I eat half as much as the other women around me, and I weigh so much more. So yes, that is very depressing. And that's another topic for another day, is how to help women with PCOS lose weight. And we are going to deal with that. So you'll definitely get that in another program. But let's talk more about the mood issues. I mean, how is it? Everyone greets everyone every day with, how are you? How are you feeling? How is it if every day you say, not good? You know, I feel sad. I feel anxious. So what are some of the other reasons, other than body image problems, that women with PCOS have such significant rates of anxiety and depression? And I want to mention to you also that women with PCOS actually also have very substantially higher rates of anger. They actually do. They feel more angry. Now, why would they feel more angry? Well, it has to do with their hormones. Hormones have a lot to do with mood and temperament. So women with PCOS tend to have higher levels of androgens like DHEA sulfate, dehydroepiandrosterone sulfate. That is a hormone that is made by the adrenal gland predominantly. They also have high levels of testosterone often, which is also made by the adrenal gland and also made by the ovaries. These are hormones more of aggression. I don't know if you know this, but if you give a male really high doses of androgens like testosterone or DHEA, they tend to be more, we'll say, violent, in fact, and in fact can be more angry and so on. So we know that there's a lot of good that comes from men having a lot of testosterone. They build good muscle and they're very strong, but it also affects their temperament and they can be more angry. So women with PCOS, because they have more androgens, also tend to have like a lower fuse and tend to be more angry. Now, I call this sometimes the irritable woman. And I do have something I can offer to you right now that can help if you are one of the women with PCOS who kind of is irritated. I call it like you have road rage, but it doesn't matter that you're on the road or not. You just get angry. Like you stand in line at the market or at the store and someone in front of you can't find their coupon or they can't get out their wallet very quickly and their credit card isn't the right one or whatever. They're delaying the line, okay? And you just feel really angry. Or you see someone, you know, like it can be road rage, you know, they cut you off or they're like putting on their makeup or they're talking on their cell phone. And by the time they start moving, the light has gone from green to red. So they make it, but you don't. You're stuck at another red light. So there's so many ways that people can be angry or annoyed. You could be angry or annoyed at your family, at your workmates, if you have children, at your children. So I call it the irritable woman. And women with PCOS tend to be more irritable. So it turns out that many of us have a lithium deficiency. Now, I'm not talking about the doses of lithium that women or men take if they have serious mental issues like disorders like bipolar disease, where they use lithium. I'm not talking about those kind of doses. Lithium is a trace metal, just like magnesium or copper or zinc, selenium, that we need in our bodies to do various functions. And it turns out that it's found normally in the earth, and nowadays we're not getting it in our water, which we normally would get in the past. So if you take a very small dose of lithium orotate, for example, 2 milligrams, but never more than 20, or you can go up, and I usually start people on 5 milligram dose, and you just take that, it can make you feel a lot calmer and a lot just more accepting of other people's mess ups and their annoying behavior. So it won't be so annoying to you when you're with other people. So think about that, whether even if you don't have PCOS, if you feel like you're the irritated person or you kind of go into road rage pretty easily, then take a little of that lithium. The company that I use is Pure Encapsulations, and they have a wonderful lithium orotate in the dose of 5 milligrams, and that's what you should start with. So we now know that hormones make a difference. Well, women with PCOS do not have proper functioning of their estrogen. Now, why is that? Well, it seems that when they're in utero, like when they're developing, their moms had something happen, whether it was a viral infection, a nutrition issue, or an endocrine disruptor like phthalates or bisphenol A. These are like plasticizers, things that can interfere with estrogen receptor development. So the estrogen receptors are not right. And therefore the feedback mechanisms, it's already a complex kind of a system that creates normal estrogen production and normal estrogen function. So that doesn't really quite work right in women with PCOS. And estrogen has receptors all over the brain, including in the areas of the brain that deal with emotions and also sensuality. So women with PCOS tend to have problems with emotions and actually also, which we'll talk about on another show, with their sexual function as well. Unfortunately, that is a common problem for women with PCOS. So it turns out that the receptors in the brain that deal a lot with emotion, the serotonin receptors, they do not work properly if you don't have proper estrogen levels and estrogen receptors. As well, a great deal of the serotonin is made in the GI tract, and the GI tract has estrogen receptors and an entire nervous system that also has estrogen receptors. And so in all of these places, in the brain, in the gut, these serotonin receptors are not really upregulated, not triggered properly. And so the right amount of serotonin, which is very key to emotional well-being. In fact, that's the neurotransmitter that the different types of antidepressants typically work on, the SSRIs, like drugs like Paxil and Zoloft and Prozac and Lexapro, Celexa. They work to try to raise the levels of serotonin. And it turns out that women with PCOS do not have proper functioning and levels of serotonin because of estrogen issues. So one of the wonderful things that you can do as a supplement is to take L-theanine, which comes from green tea. You can also take 5-hydroxytryptophan, 5-HTP, and these can help you to have more of the serotonin. Sometimes with my patients with PCOS, if some of the supplementation and the other lifestyle types of things that we do don't really work, I will actually give bioidentical hormones, and it can make a huge difference. The same thing like for women in menopause. Women in menopause have a lot of emotional problems and a lot of sleep problems, which we're going to talk about, which relate to emotional problems. And that's why giving women who need estrogen and progesterone, which is also very important for brain function. One of the things that we need to get rid of is this whole idea that there's emotional and then there's physical. They are completely interlinked, and in so many ways. So not only with neurotransmitters and hormones, but also with nutrition. So women with polycystic ovary syndrome tend to have problems with their gut. And so they don't digest food properly. They tend to have a lot of inflammation in their gut. And this relates to having improper estrogen functioning, and also because Americans and people around the world, so no longer just Americans, eat often terrible diets, and they make very bad choices for foods that are processed, foods that turn into sugar or contain sugar. And as well, even when we try hard, we often get really unbelievably toxic chemicals in our food in the form of preservatives, herbicides, emulsifiers, flavors, colors, just all kinds of terrible things that are ending up in our food, which damage our intestinal tract. We have all been exposed to antibiotics, which kill the good bacteria in our GI tract. We don't eat enough fiber to feed the good bacteria. So there's so many reasons why the GI tract is messed up in almost everyone. And in women with PCOS, because of the estrogen receptor problems, it becomes even more problematic. As well, the immune system of the body is regulated by estrogen. And because estrogen receptors are not working properly, including on the white blood cells, which are part of the inflammatory response system of the body, when you have what is called leaky gut and you have an inflamed, inappropriate bacteria and inflammation in the gut, and these inflammatory particles, which we call LPS, lipopolysaccharides, or endotoxin, toxin from within, if this leaks out, it hits the immune system, which lines the gut, and there are these white blood cells there, and they explode with inflammation, with these inflammatory cytokines, which can circle through the body and enter the brain. And the brain in turn becomes inflamed. And we now know that in psychiatry, in the more modern approach to psychiatry, that all psychiatric issues are really some form of inflammation in the brain. We know, for example, people with Alzheimer's, they will often have mood disturbances. Everything is linked. So the gut health is linked to the brain health, cognitive health is linked to emotional health. So we want to have a healthy gut, and we will be addressing how to have a healthy gut in one of our subsequent programs. But for now, I want you to know that these are the reasons why women with polycystic ovary syndrome have so much more depression and anxiety than the average woman of the same age, because of the inflammation that comes from the gut that goes to the brain, because of the neurotransmitters that are not working properly. As well, because the gut is not working properly, it doesn't necessarily absorb the nutrients properly. And if you have lack of certain nutrients, particularly things like the B vitamins, like B12 and folate, these are very critical to mood. In fact, one of the things that we do for women who have PMS is we give them B6. Okay, so we know that the B vitamins are very, very involved in mood. So I always give all my women with PCOS a very high dose of a B complex. And for some of them, I give them IV or shots, or intramuscular shots, or I give them IV pushes of the B vitamins, and they'll often feel so much better. Another supplement that is very important for having proper mood is vitamin D. So and women with PCOS often do not absorb vitamin D well. So we always check their levels and make sure they get good levels up to around 50. Another very key, very important nutrient for mood is actually omega-3. So I start my women with PCOS out for the first month on what I call a loading dose of omega-3. I use the pure encapsulations 1, so each gel cap is 1 gram of combined EPA and DHA omega-3. I have my patients take 2 of these gel caps with breakfast, lunch, and dinner. So they get 6 grams of this wonderful omega-3, and I have them do that for 1 month as a loading dose. And it's amazing how much better they feel. So in addition, I often use relaxation or calming herbs for my women with PCOS. There's so many wonderful herbs. My personal favorite is ashwagandha. Another one of my favorites is rhodiola. You have to be careful a little bit, rhodiola. Rhodiola can be activating or relaxing. So you have to sort of play around with it and find the right dose for each woman. But I love rhodiola. It really makes people smarter too. In fact, there are studies showing that when people take it, they score better on tests. In fact, I keep a bottle of rhodiola in my drawer and at the office here and at home. And if I feel like I'm tired, I just take 1 or 2 rhodiola. It's great, very safe. Some of the other herbs that are wonderful for calming effects are, I mentioned L-theanine, that comes from green tea. Others are kava and lemon balm and holy basil and passion flower. Hops is very good. Chamomile, of course, is always a sort of mainstay. And the nice thing about chamomile is that not only is it calming, but it's also very good for the gut. So those are some, and valerian root, which can also help with sleep. Now, some of these I love in tea form. There's a wonderful kava tea that you can get that is very tasty. And some of these are wonderful. When you take them as a tea, it doesn't feel like you're taking medicine, which I like. Sometimes people don't like swallowing so many capsules. So having a tea break, a calming, wonderful, relaxing herbal tea can be just the ticket to feeling calmer and happier. So I give nutrients and I give herbals. And the other thing that is so important for having a good mental health and not having too much anxiety or depression is getting enough sleep. Women with PCOS have high rates of sleep disturbance. They have higher rates of sleep apnea. They also have circadian rhythm dysfunction, which we'll be talking about in great depth in future programs. And that also has to do with problems with their estrogen receptors. So what you have to do is have a very strict, very fixed bedtime. Go to sleep between 10 and 11. And the other thing that cannot happen, which happens all too often, is what we call social jet lag. So you've heard of jet lag. That's if you go across time zones and your circadian rhythm is all messed up and then you don't sleep, you don't feel well. Well, we can do that to ourselves and we can stay right in one place. And the way we do it is by doing something completely different every weekend. Like we stay up really late until 2 o'clock in the morning on a Saturday night, then we sleep in late on Sunday, we eat at all different times of the day. That is really terrible for mental health. So it's, in fact, they now know that people, for example, who have schizophrenia have really messed up circadian clocks. So you, even though it's the weekend, you need to be like Cinderella. Okay, gotta be home by midnight. Do not stay out late. Do not then sleep half the next day. You have to have, like, keep the beat to help your clock. Your clock drifts. You have to help it to know what time it is by eating at the same time every day, going to bed, exercising at the same time. And that's the last thing I wanted to bring up, which is exercise. Exercise is amazing for mental health. It's tremendously beneficial for depression and anxiety. But the best time to exercise, if possible, is in the morning. And it's nice to do some variety of things, do things outside, because getting the sunlight and nature is wonderful for mental health. In fact, just looking at a picture of nature, like a waterfall or a meadow, actually changes people's blood pressure and heart rate and makes them calmer. So these are wonderful things. And then the very last thing that I wanted to mention is relaxation breath work. So if you do like yoga breathing, like the breath work that I learned in my fellowship was the following. You breathe in through your nose for 8 seconds. Deep, deep breath for 8 seconds. Then you hold it for 4. And then through your mouth, you slowly breathe out through a count of 7, like this, making a whoosh. So when you're feeling stressed, you take a deep breath in over a count of 8, then hold it for 4, and then slowly breathe out for 7. You can feel the calming effect. Another time, I'm going to talk about one of the other things that is wonderfully helpful for stress, emotions, anxiety, depression, and that is homeopathy. One of my doctors, Dr. Kawada, who works with me in my practice, she is an expert at homeopathy, but I am not. So I'm going to bring her in one of the future programs to talk about how homeopathy can also be used for calming the anxiety, the depression, the emotional stress that women with PCOS often suffer from. So that's my introduction to you on stress, emotions. We'll be talking much more about this and many other topics in PCOS over the coming months. I look forward to sharing all of my expertise and my experience with you. And I look forward to seeing you at my future shows. I have another one next week, which is not on PCOS, but it's on women's hearts. I hope that you'll come and join me then. And I will see you soon every month, probably pretty much even every week coming up. And I want to be a part of your life. I want to make a difference in your life. So have a wonderful evening and see you soon. Bye-bye.